This video has been provided by the Home Infusion CLABSI Prevention Collaborative. Thank you in advance for watching this video. This video shows a patient and a caregiver, such as a family member, friend, or neighbor, working together. This video will be presented in 6 sections. Section 1, Introduction. Section 2, How to get started. Section 3, Practice good hand hygiene. Section 4, Prepare your supplies and a clean workspace. Section 5, Obtain access. Section 6, Deaccessing the port. Section 1, Introduction. This video is intended for patients with port catheters that need to be flushed on a regular basis and their caregivers. This video will focus on how to access the port, flush the port, and deaccess the port. Your medical team will tell you how frequently you should flush the port, which may be as often as once a month. Please watch this video as many times as you need. If you have a caregiver who is going to assist in accessing and deaccessing the port, please have them watch the video as well. Section 2, How to get started. Your nurse and your medical team will tell you approximately what day you should flush your port. If you are a day or two late flushing your port, this is okay. If you're later than this, please ask your nurse or your medical team what to do. Now, let's talk about the most important step, hand hygiene. Practice good hand washing. Washing your hands helps reduce your chance of infection. Use soap and water at first. Make it a habit to wet your hands, apply soap until lathered, and then scrub your hands for at least 20 seconds. To make sure you are taking 20 seconds, sing the happy birthday song twice. Then dry with a clean paper towel. You can use hand sanitizer after you've already washed your hands with soap and water. If you use hand sanitizer provided by your healthcare team, rub a nickel-sized amount between all parts of your hands using friction for at least 20 seconds until they are dry. Never wave or blow on your hands to speed up drying. Even if you are using gloves, you must still wash your hands. If your nurse tells you to use gloves, put your gloves on after washing your hands. Section 4, Prepare your supplies and a clean workspace. Now it's time to prepare a clean workspace and gather your supplies. Before each infusion, find a clean, dry, hard work surface to set up your medication and supplies. If your nurse gave you a SAS or SASH placemat, put this mat on top of the work surface. Clean the workspace, including the SAS or SASH mat, with a gentle cleaning solution, such as a disinfectant spray, or with alcohol pads. Wash your hands like you did before. The next step will be to gather your supplies. Your home infusion agency will provide you with these supplies. If you are missing any supplies, contact your home infusion agency. Place each of these onto your workspace. 1 central line dressing change kit, 1 normal saline syringe, 2 alcohol pads, 1 Huber needle, 1 end cap if your Huber needle doesn't have one, 1 sharps container, 1 small trash bag. Wash your hands as you did before. Soap and water are preferred. Hand sanitizer is optional if soap and water are not available. Now, let's prepare the supplies. Start by opening the central line dressing change kit. Do not touch anything else inside the kit. Grasp the kit with both hands. With your dominant hand, hold the kit firm while peeling back the top covering. If you do contaminate the kit, discard and start with a fresh kit. On top of the items contained inside are 2 face masks. Reach into the kit carefully and remove the face masks. Do not touch any other items. Put on your face mask. If your caregiver is helping, you should both put on a face mask. Next, remove the sterile gloves and the sterile drape from the kit. Open the sterile drape and place in your workspace. Place the gloves close by, but do not open them or put them on yet. Now, place the dressing kit contents on top of the sterile drape. Now, attach the flush to your needle. Take the saline syringe. Remove the protective cover on the saline syringe. You will need to get rid of the air bubbles in the syringe. Loosen the syringe cap, but do not take it off of the syringe. Hold the syringe with the end up and plunger at the bottom. Pull back on the syringe plunger slightly to break the seal on the syringe. You will be able to see the tiny air bubble in the syringe. Slowly push the plunger up to let that tiny air bubble out. If the syringe cap falls off, you will have to start again. Tighten the cap back on the syringe. From the inside of the packaging, attach the end cap to the needle. From the inside of the packaging, grasp the hub of the needle with one hand and your saline syringe with the other. Do not touch any other part of the needle or other items in the sterile field. Now, screw the syringe onto the needle's tubing. Drape the syringe and hub outside of the sterile field while your needle remains within the sterile field. Wash your hands again. Section 5. Obtain access. First, the person accessing the port should put on sterile gloves. Place a sterile glove package onto a flat, clean surface. Open the packaging of the two sterile gloves. Make sure that the packaging remains open. Make sure you only touch the parts of the gloves that will eventually touch your hands and wrists. Pick up the first glove by the folded over cuff. Do not touch the outside of the glove itself. Insert your hand into the opening and pull the glove back over your fingers and hand without touching the outside of the glove. If you do touch the outside of the glove, obtain a new set and start over. With your gloved hand, slide your fingers under the folded over part of the cuff of the other glove. Insert your hand into the second glove. Use the first hand to carefully pull the glove over your fingers. Now, scrub the skin over the port with a chlorhexidine scrub. Push on the wings to snap and activate the cleaning solution. Scrub over the entire area for 30 seconds. Then let it dry for 30 to 60 seconds. It's time to insert the needle. First, lift the Huber needle out of the sterile kit and remove the clear protective cover on the needle. With your non-dominant hand, stabilize the port by grasping the edges carefully. With the dominant hand grasping the needle, access the port by firmly pushing the needle through the center of the port until you feel it hit the bottom. Grasp the saline syringe and slowly push on the plunger down 1 milliliter to make sure the device flushes. Draw back slowly until you notice a red flashback of blood. If you do not see blood return, unclamp all clamps. If you are still not able to obtain blood return, try one more time with a different needle. Do not reattempt with the same needle. Instead, prepare the new needle just like you did the old one. Use a new pair of sterile gloves. Now, flush your IV line with saline using a technique called pulse flush. First, hold the hub in one hand. Slowly push 1 to 2 milliliters of saline at a time. Stop and push 1 to 2 milliliters more. Repeat this pulse flush until the saline syringe is empty. If you have trouble flushing your IV line, make sure the clamp on your IV line is open. If your clamp is open and you are still having trouble, stop and call your home infusion nurse. Section 6. Deaccessing the port. We are now ready for the final step, to deaccess the port by removing the needle. Carefully grasp the needle and slowly pull it back out of the port. Apply pressure with the gauze for 60 seconds or until the bleeding stops. Dispose of the needle in the sharps container. Finally, wash your hands. You have successfully flushed your port. If you have any questions, please contact your home health nurse.